the symptom presentation is pretty variable. So it can be hard to know. It's a diagnosis that tends to be delayed by 6 to even 12 years, which, believe it or not, is an improvement from when I started in this field 20 years ago.
Hi, everyone. It's Michelle Dreilich with Evolving Ageless Podcast, the enlightened woman's antidote to aging. As you already know, I am on a mission to change the way women age. And I'm joined by experts in their field every week that share the latest and greatest research and their experiences to help us day by day make small changes so that we can live an ageless life. So today, I am excited to have a guest who is going to talk a lot about a topic that is actually pretty silent in women. It's been underdiagnosed for decades. And it's finally coming to light, and I'm excited that she's going to share some really fascinating information that is kind of contrary to what we've always thought. So I'm excited to be joined by Dr. Jessica Drummond. Hi, Jessica. How are you?
Hi, I'm great. Thanks so much for having me.
Oh, I'm so excited to talk about this. There are so many women that are struggling with endometriosis, and they don't even know about it, right? And can go almost a lifetime struggling with it.
Yeah, I think the challenge with endometriosis is that it's far more common than the average person thinks. About 1 in 10 women have endometriosis, 1 in 10 people with uteruses. So that includes transgender men. And it's important to note that, in every kind of like high school class of 20 girls, 2 of them will have endometriosis. So it's extremely common. But the symptom presentation is pretty variable. So it can be hard to know. It's a diagnosis that tends to be delayed by 6 to even 12 years, which, believe it or not, is an improvement from when I started in this field 20 years ago. 20 years ago, the delay to diagnosis was closer to 15 years. So we've made a little bit of progress there. But the challenge with endometriosis diagnosis is that it's a surgical diagnosis. So there are no like lab markers or imaging that is helpful to, for endometriosis experts who, are really immersed in this. They can use that data to help decide whether or not a surgical, going in for a surgical diagnosis is appropriate. But there isn't like a simple blood test to decide if you to be diagnosed with endometriosis or not.
That's interesting. And so you're saying 6 to 12 years to diagnosis, which means for those years, very often they are during a woman's kind of peak fertility cycle, I would imagine.
Right. One of the biggest challenges, and one of the probably the biggest reason that I wrote this book, was that there's some recent data that was presented at one of our international pelvic pain meetings about a year and a half ago, that was showing that women, like 74, it was either 72 or 74% of women who have endometriosis feel like their life's trajectory was influenced by it. So this diagnosis, the core symptoms present as early as pre-puberty, so girls who are 8 to 10 years old, but begin to be more pronounced as the cycle regulates. So in the teen years, in the 20s, sometimes it's silent in terms of some of the symptoms, but then can affect fertility. So during this time, if you think about having really intense, debilitating pain, that's sort of vague though, and causing you to miss school, miss your SATs, feel terrible on the day of your SATs, feel terrible on the day of your big, history presentation, the day you're trying to take some exams, final exams in college, the day you're doing your recruiting visit for the lacrosse team, the day you're doing your big interview for the next job you want to get. this disease is very difficult to have for women to stay on their career trajectory because it's so unpredictable, or even if it is predictable, it's so significant in terms of the symptoms that women appear flaky, who really, in my experience, tend to be very driven. They've overcome a lot just to show up in terms of the pain and the digestive symptoms and the anxiety and the brain fog. And so 74% of them say that the disease itself, because of when it's really presenting, takes them off the path of their life's goals.
That makes a lot of sense.
Mm-hmm.
So we talked a few minutes before. I want to jump in on, our audience is, 40 and older. And I know that before anyone on listening says, this doesn't sound like it's appropriate for me, I want to jump in and say, we're going to talk about women at all stages of their lives. And certainly, if you're a woman that's postmenopausal, we're going to get to that. But you also likely have children or grandchildren that this has an implication for. And you did mention that this is genetic as well. There's a genetic correlation that runs through families with endometriosis. And very often, I know, from my own personal story, generations ago, the science really wasn't there. So even though we say things are genetic, it doesn't mean we know that our grandparents or parents had these conditions. They just suffered in silence and, or had a hard time getting pregnant, and kind of passed that on. So let's start with this idea, because you did mention it starts with puberty very often in women. And I thought the most fascinating thing that you said earlier was, it's not symptoms necessarily tied to, let's say, a period or even part of the menstrual cycle that can be tracked. Let's talk a little bit about that, because I found that extremely fascinating.
Yeah, so especially early on in teenagers, often later in the 20s, 30s, 40s, the pain does look like intense period pain, which is one of the reasons I think, generation to generation, it can be sort of dismissed. Because imagine if many of the women in your family had intense period pain, taking them out of work or activities, or just really forcing them to take a lot of medication and power through. It begins to be normalized even within the family. Oh, welcome. This is what periods are like in our family,
Yes.
And so the conversation is not around trying to find support for that, because it seems like it's normal. And it is kind of a normalized thing to have out in society, right? We were like, oh, your period, it's going to be awful, and you're going to be in bed for days, and you're going to be bleeding so heavily. And that's actually not normal. It's very common, as we talked about. And of course, in families where there's more endometriosis, it's more common. So from the get-go, girls are taught like, oh, this is just what it is, learn to suck it up, or take handfuls of Advil or whatever, or go on the birth control pill. But so in the 40s, when, let's say, I'm a mom of a teenager, I'm in my 40s, and if I had been suffering with endometriosis my whole life, which I haven't, but, in that scenario, I might have just said to my daughter, like, oh, welcome, this is what it is.
That's really important. I hate to interrupt. It's really important, because that's how, you're right. It's cultural. Like, it's our family culture, right? Where you say, welcome to being a woman. This is what it's like. And in our family, women have fill in the blank, right? And so I would imagine it's not until a woman is much older and, living on their own and having these conversations with their friends where they realize this isn't normal.
Right.
So that's really helpful. And this is really important information for any of the listeners who have themselves or children or grandchildren that are struggling with, even thinking that this was normal in your own family, because it's not. So that's great. So let's go back and talk about the earlier years where it's not tied to, welcome to the family. We have
Welcome to the
painful
family periods.
periods.
Yeah.
Right.
Right. So early on, it's actually more common in the tween and teenage years, like when the menstrual cycle is first beginning, for the pain to not be clearly cyclical. And that's challenging because then it's confusing. Is this a digestive issue? Is it stress? Is it an injury? Is it over exercising or overtraining for a sport? So in girls who are, 10 to 16, let's say, we're looking for a pain that's significant enough to take them out of school or activities or work. And in fact, endometriosis is the number one reason that girls miss school. And I think that's important for every school nurse out there, every teacher, to bring some awareness to.
So you had also mentioned that the predominant symptom is not necessarily period pain. It looks more like irritable bowel syndrome or IBS or digestive issues, digestive pain, stomach ache. So if someone that you know and love suffers and they're younger from these symptoms, and doctors with IBS, I think they always go toward, oh well, it could be something you're eating, or maybe you should cut out gluten or dairy, depending on the doctor, which is really more progressive than most practitioners. But to know that those symptoms, when they lead to a dead end, could often mean that there's endometriosis at play here.
Correct. And so there is this specific like pelvic pain, deep pelvic pain, which can refer to back, hips, if you think about it. Endometriosis, by definition, are growths of endometrial-like tissue. So the lining inside the uterus is called the endometrium. And endometriosis are when there are growths of tissue that are similar to that tissue, but not exactly the same. And so this can, there have been studies done even on fetuses that these growths can be present from the get-go, and then they're become more symptomatic later, and proliferate and grow and deepen and that sort of thing. But the growths themselves, by definition, occur outside of the uterus. So they can be all over the intestines. There's a lot of adhesion. They can be on ovaries, on the bladder. There's a lot of bladder pain and symptoms associated with endometriosis. They can even be on the diaphragm, the lungs, the nose, the knee. It can be all over the body. It's been found, it can cause collapsed lung. It can cause knee pain. So it's a more systemic disease than, often we think endometriosis. Oh, that's like gynecologic, This is about your women's organs, right?
Yeah. And I've always thought that, right? Like I've suffered from endometriosis, and surprise, surprise, I had fertility issues. I've talked about that on the show before as well. And both of my beautiful children are in vitro fertilization. It worked both times for us, but it wasn't without that painful diagnosis, frankly, because, finding it was difficult. But I had no idea that, and it makes so much sense. I mean, it's rogue tissue that continues to grow and proliferate. It needs room. So it could move throughout the body. And so when you say adhesions, just to be clear, that means it sticks onto things and connects things that aren't normally connected, right? Like your intestines and your bladder are not connected. But if you have endometriosis that as it gets worse, it starts to connect things. And that's where the pain comes from, because they're moving, they're being pulled and tugged on. I would imagine that they shouldn't be. Yeah. Wow.
Yeah.
That is remarkable.
And so initially, what that often, well, not initially and for years, there's something that women call endobelly. It's essentially like bloating. The biggest symptom is bloating, right? Did you experience that? Like just constant bloating.
Absolutely. Yeah. Yep.
And so, of course, nutritionally, we can deal with that because very often there is small intestine bacterial overgrowth or small intestine fungal overgrowth. Like there's some bacterial imbalances in the intestine. But when it comes to endometriosis, it's not as easy as just killing that off with antibiotics or even antimicrobial herbs, because structurally, due to either the lesions or those sticky adhesions that you talked about, the peristalsis, the kind of movement of the small intestine and the large intestine, is altered by that stickiness. So there's little pockets that make it really glamorous for these bacteria and fungi to grow, right? They're little pockets. They're not getting a lot of motion. There's tons of food.
Yeah. Wow. This is really deep. This is not just, this is, in a sense, it's radical based on what we've always thought about. Like, you're right. I think all women associate endometriosis with it's part of my parts, right? It's just one of those things. The other side of it, though, that is just kind of dawning on me is the fact that it's inflammatory, right?
Correct.
And so when we think about inflammation in our body and we think about the propensity to develop chronic disease, things like diabetes and heart disease and arthritis, any of the itises down the road, having just smoldering fires in your body. We've talked about this before, whether it's blood sugar causing that smoldering fire. Endometriosis is one of those things. And so I love your approach because you talk about using lots of lifestyle things, right? So the way we eat, the way we move. So let's talk about some of those lifestyle things. And don't worry, we are getting to what it means in postmenopausal women too, because I think this is fascinating.
Well, and this is one of the pieces of the puzzle for postmenopausal women, right? Because we want to lower our risk for cardiovascular disease. Heart disease is still the number one killer of women. We want to lower our risk for autoimmune disease. So endometriosis, I think of it as having kind of three different underlying root causes from sort of a functional medicine perspective. One is the genetic underpinning, two is the inflammation, and three is there are lots of indications in the literature that it has autoimmune components. And so one thing that does happen, that was just presented at a meeting less than a year ago, like 2 months ago, right before the pandemic, that when you do endometriosis excision surgery, so take out the lesions, a skilled surgeon takes out those lesions, at least for, I believe the data was followed at least 6 months, but maybe even a year, the autoimmune markers reduce.
Oh, so there is an autoimmune component. Wow. We never list endometriosis as an autoimmune disease, right?
Right. And it plays, it presents with a number of autoimmune diseases, particularly Hashimoto's thyroiditis. So imagine if you're dealing with lesions, adhesions in and around your reproductive organs, you've got period pain, painful sex, and you have elevated inflammatory markers, elevated autoimmune markers. Of course, it's going to be challenging to get pregnant and your, other autoimmune diseases. So now having that surgery is one piece of kind of the puzzle of autoimmune based fertility. So a long time ago, there was sort of this split in reproductive endocrinology, reproductive immunology, and reproductive immunology is not something we really think about much because there's many more reproductive endocrinologists. Right. But if you think of endometriosis as having some autoimmune factors, and then you can reduce those with surgery and with lifestyle medicine. So we'll get into specifics in 1 second, but you lower that autoimmune challenge, and then it's a lot easier for women to become pregnant within that first 6 to 12 months post-surgically.
Wow. Hello. There's our gluten-free recommendation, right? Because we know gluten and autoimmunity go hand in hand. So, it's interesting because over the years, there have been so many patients that even just a gluten-free diet changes infertility significantly. And so I've never even thought that would be connected in some way to endometriosis. That's fascinating.
Yeah. So, from a lifestyle perspective, there are so many things we can do to optimize immune health. And we want to think both of inflammation and of autoimmunity. First of all, is clean diet, starting with a very simple elimination diet of things like dairy, gluten, sugar, soy. Even if you just do those four things, you're making big progress. But one thing that happens with women with endometriosis, because they have digestive issues from the time that they're 8, 9, 10 years old, they start to become afraid of eating anything. They're worried that everything they eat is making them fat when it's really just bloating. And so, you have the emotional overlay of eating disorder that can happen from frustration, pain, bloating that happens with eating in the teenage years. And so women, by the time they see me, often they're restricting and restricting and restricting. So, or they've like tried gluten-free, but not really consistently for a long time, and it didn't really work, or that wasn't enough. They had to do a more deep elimination diet. But still, the approach to it, even if there is some need to eliminate certain foods, the approach is to think about what foods to add. And we want to be really thinking about adding anti-inflammatory foods, fruits and vegetables, especially vegetables, because sometimes there's candida issues as well, but especially vegetables, 8 to 10 servings a day, which at first we want them cooked and easy to digest because, you don't want to flare up the bloating, but more vegetables. The other thing that's really powerful medicine from an anti-inflammatory and autoimmune support perspective and digestive healing are herbs and spices. So a lot of people don't know how to cook. You certainly aren't thinking of this when you're 20s. You're just like, getting takeout and going to happy hour with your friends and stuff like that, right? So ideally, we want to reinvigorate home cooking with oregano, garlic, rosemary, turmeric, ginger, cinnamon. All of these herbs and spices are very powerful anti-inflammatory medicine, really. And doing them, eating that way day in and day out, thinking about what to add versus what to restrict is where we start to improve nutrient absorption, healing of the digestive function, lowering of inflammation. And then concurrently, obviously this disease in and of itself is very stressful because unfortunately the traditional medical world deals with this terribly. It's basically like, oh, maybe you have endometriosis, go on birth control or go on some really extreme estrogen suppressing drug like Lupron or something similar, right? And so there's not and that's often done without good, even surgical diagnosis or even thinking about lifestyle strategies that can impact this without just sort of masking the symptoms. So for women where the birth control pills do kind of help the symptoms, that's great, but they haven't learned to really understand what's going on in their body. And so as soon as they try to come off hormonal birth control, first of all, they may have tons of side effects, anything from depression to low libido to vulvar pain. We could just move the pain. So it's not an answer. It's a useful tool in some cases. And there are many medications that are used to treat endometriosis, all of which have some useful, can be useful in certain situations, maybe as a bridge to surgery or just to be able to tolerate making these changes for a while. But none of them solves endometriosis. That's not a cure. And so when we just Band-Aid it like that early on, maybe the symptoms are masked, but then again, in postmenopausal years, you end up paying for it with dementia, with osteoporosis, with cardiovascular disease.
Whoa, right? Listen to that. That's crazy. So we just made a giant leap, but it's one that I think we need to pay attention to. So we went from fertility issues, period pain, right? Lifestyle changes, birth control to get you to, a bridge, as you said, to surgery, but then made the leap that says, if completely ignored and again, treatment can be lifestyle intervention, right? It can be changing the way you eat, as you mentioned, getting those anti-inflammatory foods, lowering blood sugar foods, things like that. But the leap you made is very real, right? This is the chronic disease leap that we're talking about when we age and the trajectory at which we age. And so if left completely, like, oh, I can't wait to get to menopause, right? Because that's the myth. I can't wait to get to menopause because then all these hormone related problems go away. And so I just want to point out that the leap you made was things like dementia, right? So dementia, Alzheimer's, things like that, those are called type 3 diabetes now in the world we live in, right? So we know that excessive inflammation, right? And in this case, caused by sugar or poor diet, leads to things like dementia and so on. But I think this is the perfect shift to say, okay, women that have suffered with endometriosis or infertility, listen, I put myself in that camp. Like, oh, I can't wait to get to menopause because when I do, these hormone problems go away. And so let's hear it, lay it on us, because this blew my mind.
Yeah, I think so. Now we're thinking, okay, you're landed in your 40s and you're thinking, great, I'm almost to menopause. I'll stop having all this estrogen and this is all going to go away. Or conversely, your doctor's like, oh, we'll just do a hysterectomy. And then, are you done having kids? You're 34. Fine, let's just take it out and, we'll leave your ovaries. But we need estrogen as women. We need it for so many things. There are 300 estrogen receptors in the body, at least. Brain, bones, heart, vaginal lubrication, which is not just about sexual health, but it's also about things like chronic yeast, chronic BV, right? So we need our estrogen and our progesterone and our testosterone as long as we can have them, because they help carry us through a longer health span after menopause. So if you just do a hysterectomy, first of all, you probably haven't solved that problem, because remember, this is a disease that's outside of the uterus by definition, though there is a similar disease called adenomyosis, which is in the lining of the uterus. And in some cases, in that sense, it would be appropriate to do a hysterectomy. But either way, you land in menopause, either due to surgical menopause or because you're in your early 50s. And up until now, you've just been trying to suppress your hormones to reduce your symptoms. Now, wherever you are in your kind of 30s to 60s and above, here's your opportunity to optimize your inflammatory and immune health, because this is not just a hormonal disease. And we don't necessarily want to, for the long run, suppress our hormones. There's so many benefits beyond reproduction to these hormones. And as we were talking about before, endometriosis lesions are not what we thought originally, was that they were just fed by estrogen. So you just deplete the estrogen with medication or even lifestyle, nutrition, trying to really deplete estrogen. But the truth is, there was a study published back in 2018 that showed, and more histology has been done since then, that these lesions are highly variable. Some, there's upregulation of the estrogen receptors. Some, it's progesterone. So if some of these medications are going to do more harm than good. Some, it's both. Some, it's neither. And these different kinds of lesions can all be present in the same woman, and there's no way to know which one it is until after they've been removed, where it doesn't matter.
And that's the mind-blowing part of this, right? Which is, we've thought it was a hormone-driven condition, whether it's estrogen or progesterone. And it can be, but it also doesn't mean that it is. It can also not be hormone-driven. So what blew me away there was, as women, we're thinking, oh, I'm going to be in menopause, things are going to get better. Or I've suppressed my estrogen all this time. And we've talked about estrogen on many shows and about the benefits of estrogen, and how, when estrogen goes south, so many things that for a woman go south. But I think the really mind-blowing piece of this is that study that you're referencing is 2018. Like, That's 2 years ago, a year and a half ago.
Yeah.
We're just now figuring it out and recognizing it. And it's fascinating to me that you're really, this is your specialty. You are on the cusp of something absolutely enormous, because I just don't think we've given this the gravity that it deserves, right? I
Right.
can imagine there are many women that are postmenopausal that are still dealing with bloat that may be endometriosis related. And especially as an older woman without having a menstrual cycle to tie it to and correlate it with, I could see how it would be, and no doctor would think to even consider it postmenopausal, because as of a year and a half ago, it was completely driven by estrogen and progesterone.
Right. And I think so for women postmenopausal who are, as you said, kind of for the preteens and women over 50 who have these chronic digestive issues that are not being solved by GI interventions, even by functional medicine interventions. Because if we think about those lesions impacting the root cause of these digestive issues, which is really going to be motility, functioning of the ileocecal valve, like a pure structural challenge with the digestive function, then utilizing this more comprehensive approach is going to be so important. And not only that, but sexual pain in women over 50 is almost always chalked up to menopause. Your vagina is dry, blah blah blah. But it's not always that. There's deep pelvic pain, which could still be endometriosis related. Endometriosis also often presents with vulvodynia, with interstitial cystitis, which is a bladder pain condition, because these are all autoimmune driven. So instead of just being like, oh, you need more vaginal estrogen, or, too bad, you're in menopause, like, this is it, your vagina is going to be dry. Let's go a little deeper and think about some of these other things that can happen, and to keep your health, your immune health, your sexual health, and even your overall health in terms of that inflammatory piece, much stronger, much more robust, much healthier all the way through your 80s and 90s.
Oh, amen, sister. That's what we preach, right?
Yeah.
It's making these small changes. And so Dr. Drummond has a book called Outsmart Endometriosis. And the beauty of it is it's an ebook, and she offers it as a free download. And I will say this, I'm absolutely downloading this. And I think all women should look at it, because just as we've said, it's one of the most undiagnosed conditions out there. It often takes a decade to figure it out. And frankly, for women my age and above, we may not have ever known that we've had it. We weren't always looking for it. And certainly when you find yourself in a reproductive endocrinologist's office, their number one goal is to get you pregnant. And it's like slam, like you hit the big leagues, and they own every hormone in your body. And everything gets overridden and until you're pregnant. And so I'm sure there's probably even some long-term effects from that, that are at play. So absolutely do yourself a favor. When you go to evolvingageless.com, on this show, in our show notes is a link for that free download. Download it for yourself. The tips in that book will help you not only just help your endometrium, or deal with endometriosis, but these are all tips that guide healthy living, right? It's about changing that trajectory just a little bit so that you end up in your 80s much healthier than you would have been otherwise. These are the small changes, right, of evolving to become ageless. I just love it. And so definitely download that guide, read it, send it to a friend, have a friend download it. Share this podcast, because this is completely new information. We are talking about cutting edge stuff here that most practitioners are not even focused on. And so the other thing that I think is amazing is that Dr. Drummond works virtually too and does consults virtually in 60 countries globally. So don't worry if you're in a different state. That doesn't matter. If you feel like this is something that you'd like to pursue, there's also a link on evolvingageless.com in these show notes where you can click through and learn more about Dr. Drummond's practice, what she does, her perspective on endometriosis, even more than this, and see if that's something maybe that you would want to pursue.
Yeah. And I
I
would
think
just say
that's
that,
wonderful.
the perspective in the book is going to be really helpful, even if you're not struggling specifically with endometriosis,
Right.
but as you said, a related condition like fibroids or sexual pain. So it's for
That's
everyone.
great. It's for everyone. Everyone. I love your saying periods should not be painful, right? That's a message that we can pass on to generations and generations and stop the madness of welcome to the family. We have heavy periods and painful periods. They should not be painful. So, Dr.
Yeah.
Drummond, thank you so much for taking your time. This is really fascinating and really monumental information that I think will absolutely help change the health of women for generations to come.
Thanks so much for having me. I hope so.
Yeah, that's great. All right. Well, that's this week for Evolving Ageless. I'll see you here next week, same time, same place. And I look forward to helping you make these small changes day by day, week by week, so that you can ultimately stay at the top of the hill, right? And stay ageless. All right, everyone. See you soon.